Hello and welcome to this podcast about the next steps on the NHS 5-year forward view. My name is Charan Sira and I'm a Senior Associate with Visions for Health, which is a healthcare network consultancy specialising in market access, working to bridge the gap between the NHS and industry. In today's podcast, I will aim to give you a summary on the next steps on the NHS 5-year forward view, specifically in relation to primary care, and highlight the implications of this whether you work in the NHS or for the industry. You may be aware that on 31st March 2017, NHS England published a follow-up document to the 5-year forward view called The Next Steps to the 5-year forward view. This document sets out the NHS's main national service improvement priorities over the next 2 years within the constraints of what is necessary to achieve financial balance across the health service. We know that majority of NHS care is provided by general practice, and one of the things the public want to know is that they can get an appointment with a GP when they need one, which means having enough GPs with adequate resources to deliver quality care. We also know that funding for primary care has historically been on the decline. However, there is a commitment to increase investment in GP services so that by 2020-2021, funding will rise by 2.4 billion, which equates to a 14% increase in real terms. This will mean improved access to care, a stronger focus on prevention, and better integrated services, to name a few. One of the key improvements for 2017 to 2019 is to make patient access to GP services more convenient, for example by extending access to GP appointments at evenings and weekends and triaging patients to offer same-day urgent appointments while still maintaining care for patients with long-term conditions. The government has set an objective of an extra 5,000 doctors working in general practice by 2020 to support this. Over the next 2 years, NHS England is on track to deliver over 3,000 GP recruits with an extra 1,300 clinical pharmacists and 1,500 more mental health therapists working alongside them, with a view to improving access to primary care as a priority. An introduction of the new roles, such as physician associates, will require further definition and development to ensure they are well suited to support the demands of primary care. To help with the delivery of initiatives, practices are being encouraged to work together in hubs or networks with a combined patient population of at least 30 to 50,000. This will allow sharing of key services such as community nursing, mental health and clinical pharmacy teams, including an expansion of diagnostic facilities, therefore pooling responsibility for urgent care and extended access. The beauty of such a model is that it doesn't require practice mergers or closures and doesn't necessarily depend on physical co-location of services. Most STPs are supporting the move to create federations, super surgeries or multidisciplinary community providers, and this proactive collaboration will benefit the care of patients. Contract reform is another route to improve services over the next 2 years. There is now wide agreement that the Quality and Outcomes Framework, QOF, has run its course and is now partly a tick box exercise. A successor to QOF will be developed, which will allow the reinvestment of 700 million a year into improved patient access, professionally led quality improvement, greater population health management, and patient-supported self-management to reduce avoidable demand in secondary care. In addition, over 800 infrastructure projects have been identified for investment by 2019, where primary care premises will be upgraded and modernised, which will benefit both patients and staff. The expansion of the primary care multidisciplinary team brings with it many new opportunities for workforce expansion. Opportunities exist for training and development of new roles, as well as for upskilling existing roles. Exploring the concept of collaborative working within these new primary care roles will be key to streamlining how best quality care is delivered in an efficient manner by the most appropriate healthcare professional. No longer is the care of a patient solely managed by a GP, but rather by a multidisciplinary team who will need training to ensure they are upskilled appropriately. General practice is the bedrock of NHS care and provides over 300 million patient consultations each year. Collaborative working with community services, secondary care and mental health is not a novel idea. However, it seems there are now prospects to making this an actual reality. Thank you for listening to this podcast on the 5-year forward view next steps. If you have any questions or require any further information, please email info@visionsforhealth.com. Goodbye.